All right, or welcome to today's presentation on Let's Talk About Safer Sex. And this is presented by Student to Wellness, and we are a part of counseling and consultation services here at NIU. My name is Julie Rubel, and I'm here with Marissa Mazer, and we are graduate assistants here at Student to Wellness. We are in the counseling program at NIU, and we are done in May, which is super exciting. And so moving forward, I just kind of want to provide a disclaimer that this has been a learning experience for us both in terms of this information and learning and everything like that. So if anyone who views this has any questions about how the content or was curious about anything, please just go ahead and email us at bewell@niu.edu. As I said, this is a learning experience for us as well. And so we will go ahead and try our best to be as inclusive as possible. So today we're going to be talking about these things on the outline. So safer sex, what is your risk? Safer sex supplies, STI prevention, and talking about sex in terms of communication. So that's kind of what today's presentation is going to look like. And so starting off with safer sex. And so safer sex defined is practicing one or more behaviors that will reduce your risk of contracting an STI or becoming pregnant. We're going to be talking about STIs a lot, which stands for sexually transmitted infections, but I'm going to refer to it as STI as well as Marissa will. So what does safer sex mean? So this is used instead of safe sex because every sexual contact involves some form of risk in terms of getting an STI or becoming pregnant. And so anytime you have vaginal, oral, or anal sex with someone or hand to genital contact with someone else's genitals, you can transmit an infectious disease, i.e. an STI. So that being said, the only way to reduce your risk of getting an STI is to not have vaginal, anal, or oral sex and to avoid sharing bodily fluids. So what are the different types of safer sex behaviors and options in which you have? And we're going to dive into all of these today. So starting off with knowing your risk, using safer sex supplies, getting tested, and communicating with your partner or partners. And so to start off, just go ahead and ask yourself this question, or what actions can you put at a lower risk for contracting STIs or becoming pregnant? And so, or what behaviors do you engage in or have you thought about engaging in, and how do they fall on the spectrum of low risk or no risk to high risk? And so to kind of start off, we're going to start with no risk and low risk behaviors, in which I'm going to talk about more in the next few slides. So I'm just going to touch on moderate risk behaviors and high risk behaviors, because by engaging in intercourse, and whether that is vaginal, anal, or oral sex, you are engaging in moderate risk or high risk behaviors. And so just keep that in mind in terms of engaging in intercourse. So what does no risk behaviors mean? And so this means engaging in abstinence. And abstinence is avoiding oral, vaginal, and anal sex. And so this is choosing to not have sex, except this does allow for kissing, massaging, and masturbation. And this is the only risk-free option that there is in terms of sexual behaviors. And this is the only way to prevent pregnancy. And as I stated already, it's 100% effective against transmitting or contracting an STI or HIV or becoming pregnant. To emphasize, no sexual contact is the best way to prevent an STI. Now to move on to low risk behaviors. Outer course. And so outer course is mutual masturbation or oral sex. And so this does not include vaginal or anal sex. Outer course is basically anything on the outside of the body. And it can be 100% effective for for preventing pregnancy as long as the penis does not ejaculate near the vaginal opening. So unlike abstinence, however, it is not 100% effective against STIs or HIV. And this is because oral and genital contact can transmit disease, although practice can be made safer by using a condom on the penis or a latex barrier, such as a dental dam over the vulva. And we're going to dive into those in the next slides. So we're going to talk about using safer sex supplies now, what they are, how the different types of forms, and where to find them on campus. And so there are two types of condoms, external and internal condoms. And so to start off, I'm going to talk about the external. And external condoms can protect against STIs and pregnancy, but are not 100% effective. External condoms are what people traditionally think of when they think of a condom, and its formal definition is that it's a single-use sheath of thin latex or other material designed to fit over an erect penis and to catch semen upon ejaculation. So as you can see in the diagram, the tip of the condom is where the semen is collected, and that's why it's important to make sure that you leave some space on the tip of the condom when you put it on. Now to discuss internal condoms. These also protect against STIs and pregnancy. And internal condoms are called internal because they go inside of the body, whereas external condoms stay on the outside of the body. And an internal condom is an alternative to the external condom that is inserted into the vagina or the anus. So this internal condom is a little bigger than the external condom is, and that's because there's a flexible plastic ring at the end. And so as you can see, it's a little bit bigger compared to the other diagram. Now we're going to discuss condom size. And so while condoms are manufactured as one size fits all, standard sizes and the tightness of the elastic rings are going to vary by the manufacturer. Some condoms are a snugger fit, while others are larger sized. And so how do you know what size to get? The fit should be snug, yet comfortable and fit. And so the fit is going to decrease the chances that the condom is going to slip off during intercourse. And so this is why it's important to make sure that you find a condom that fits you just best and right. A wrong condom size can increase your risk for an STI or unwanted pregnancy. And then condom texture. And so something that you will notice when buying condoms are brand descriptive terms for texture. And so some examples of this are ultra thin, sensitive, high sensation, or extra strength. And other choices, it might say ribbed or studded condoms. And so all of these are designed to give one or both partners increased pleasure. And so how do you know what to get based on texture? So at the end of the day, it's all between what you and your partner or partners are interested in. And so some people prefer thinner condoms to allow for more sensation, while the others are going to prefer thicker condoms to feel more secure, although studies have shown that ultra thin condoms are just as effective as regular condoms. All right, now we're going to discuss lube. So on here, it's lubricants or lube is what I'm going to refer to it as. And lube is there because it reduces friction, which can cause tiny tears in the skin, which can make it more likely for the person to get an infection if their partner has one. And so why is reducing friction important? It's because it reduces the risk of contracting an STI, helps the condom not tear, and can be more enjoyable and comfortable. And so it's extremely important to use the lube when having anal sex, and this is because compared to a vagina that naturally lubricates, the anus does not. And so that's why it's important to utilize that on top of using condoms. And be mindful of the lube that you purchase, and just have the awareness that flavored lube is not for oral sex. That flavored lube is for oral sex and not intercourse. And this is because flavored lube tends to have flavoring and sugar in it, which can actually lead to a yeast infection when used incorrectly for intercourse. And then there's water-based, gel-based, and silicone-based. All right, now we're going to discuss how to correctly use an external condom. So the example in which we have here, it's kind of like putting on a tube sock and ensuring that it's fitting you correctly, that there's enough room in your foot in your sock, and then you have to touch the tip and everything like that. And so I have a video for that if interested, and I will leave it in the link. But to move forward, we're going to talk about how to correctly use an external condom. So first and foremost, always, is to get consent. And we're going to discuss this a lot more in just a few moments. Check the expiration date to make sure that the product is still at its peak and that it is still going to have all the factors in which it's supposed to work properly. Check the packaging and make sure that the product is not damaged. Tear open the packaging very carefully because you do not want to damage the packaging or create a tear or a hole or anything of that matter. Add a drop of lube inside of the tip. Pinch the tip of the condom. Roll down to the base of the penis or object. Burp the condom. So this is where you make sure that there is room at the end of the penis for the semen to be collected. Add lube to the outside of the condom. And then you engage in the action. Hold the base of the condom while pulling out to ensure that everything is still there and that the condom does not fall off. And then remove it and throw away. All right, now moving forward, we're going to talk about dental dams. And so these are other barrier methods. And so a dental dam is used for oral, vaginal, or oral anal intercourse. And they come in different types of colors and flavors. And you can make one actually out of an external condom. Two more barrier methods. There is the diaphragm and cervical cap, and so this blocks sperm from getting past the cervix, and these can be used more than once if they are cleaned properly. And these will only protect against pregnancy. And so if you use this, you still have the possibility of getting an STI. Next, hormonal methods, and so these are widely used and usually just known as birth control. So there's the pill, the patch, the shot, IUD, or the ring, and these protect against pregnancy only. And it's important that you make this decision under a doctor's orders, and you can go ahead and just gain information from your doctor or health services on the different types of methods and what works best for you. And lastly, in terms of the portion I'm going to be completing today, is where to get safer sex supplies at NIU. And so you can get different types of safer sex supplies at health services, and they have external and internal condoms. You are able to pick up 10 per day, and it is free to students because it is covered by student fees. Now I'm going to pass over the presentation to Marissa, and she's going to finish it up.
All right, so next I will be talking about STI prevention. So for this, we're really just going to be talking about getting tested, preventing STIs, and really knowing the signs and symptoms of STIs to lower your risk. With that being said, what is an STI? An STI is a sexually transmitted infection. And there are different types of this that we will dive into more in depth. The first one being bacteria, the second virus, third, parasitic, and we will also dive into pelvic inflammatory disease. It is not an STI, but it is related to them. So the first one are bacterial sexually transmitted infections. These are transmitted through semen or vaginal fluids via oral, anal, or vaginal sex with an infected person. For treatment, typically it is antibiotics, and there are different types of bacterial STIs, chlamydia, gonorrhea, and syphilis. So the first one, chlamydia. This is the most common STI. Most people have no symptoms, but some people may. So a person with a penis may experience discharge and burning when urinating, especially during that first trip to the bathroom in the morning. A person with a vagina may experience itching, vaginal discharge, burning during urination, and discharge around the cervix. The next bacterial STI is gonorrhea. Most people have no symptoms, but a person with a penis may experience yellowish discharge and painful urination, and a person with a vagina may have inflammation of the cervix, cloudy vaginal discharge, abnormal menstruation, pain during urination, or lower abdominal discomfort. The next bacterial STI is syphilis. This is transmitted when infected lesions come in contact with the vagina, urethra, or an abrasion during vaginal, oral, and anal sex. And that's even if there is no sexual penetration. So some experience no symptoms, or they may experience chancre forms such as oozing, sore, such as an oozing sore on the penis, scrotum, or in the vagina. And if left untreated, a rash or white patches will appear. So over time, the bacteria will invade the body and lead to many health complications, possibly even death. All right, so now I'm going to dive into the viral STIs. These are transmitted from skin-to-skin contact via oral, anal, or vaginal sex with an infected person. The treatment types do vary. I'll dive into each kind of viral STI, but we will go over the human papillomavirus and genital warts, herpes, oral and genital, as well as HIV and AIDS. So the first one, HPV, human papillomavirus, and genital warts. These are very common. HPV is a virus that causes genital warts, and it can also cause cancer. Typically, the transmission is through skin-to-skin contact during vaginal, anal, or possibly oral sex with someone who has an infection. Symptoms, many people will have no symptoms, but other people may experience the growth of warts on or in the genital area. So for treatment, definitely we'll need a visual exam to detect the warts. High-risk forms of HPV like cancer can be detected through a pap smear, but there is no test for HPV in men. So topical medication or removal for genital warts may be used. So herpes, oral and genital, this is caused by a virus. The transmission is skin to skin, vaginal, anal, or oral sex with someone who has the disease. So orally, that's going to be the skin to skin, using the same utensils, straw, lip gloss, etc. with an infected person. And this can spread to genitals and your eyes. The genital transmission is going to be genital to genital, genital to anal, genital to oral, and sores do not have to be present to be passed on. So in terms of symptoms, orally, you may have small pimple-like sores that form on the lips or around the mouth. Genitally, those are going to be sores in the vaginal or anal area or on and around the penis. So breakouts will happen from time to time after initial infection. And for treatment, blood tests are used to diagnose genital herpes. There is currently no cure for herpes. So there are medications available, though, to help with outbreaks and to decrease the chances of transmission. The next STI, the viral STI, is HIV/AIDS. So that stands for human immunodeficiency virus, and AIDS is acquired immune deficiency syndrome. So that is transmitted through blood, semen, vaginal fluids, and breast milk of an infected person. Symptoms. When first infected with HIV, you may present swollen lymph nodes, fever, headache, fatigue, joint pain, or maybe even a rash. So this is very similar to symptoms of the flu that will last up to a month. And this will be followed by a time where people typically experience no symptoms for varying lengths of time. So if you are experiencing any of those symptoms, of course, just take a moment to go to your doctor and get it checked out. But in terms of treatment, HIV can be diagnosed only through testing orally or through the blood. So AIDS must be diagnosed by a healthcare professional. And there is no cure at this time. However, there are medications that are used to increase your quality of life and really just slow down the progression from HIV to AIDS. So now we'll be talking about the STIs via parasites. So this is going to be those parasitic infections transmitted orally, anally, or vaginally through sex with an infected person or item. So it's important to emphasize the item. This could even be like on a sex toy, for example, that hasn't been cleaned. Treatment types do vary. We'll dive into each one, but we'll go over pubic lice and crabs and trichomoniasis. So for the pubic lice and crabs, this is the parasitic infection. It is transmitted through sexual contact or close contact with infected bedding and clothing. So symptoms can include itchy bites. You may also be able to see them, the parasitic insect. But for treatment, there is a special shampoo available over the counter at drugstores. But also important to wash your clothes and bedding in a hot water cycle for at least 20 minutes to help with that. The next one is trichomoniasis. This is caused by infection with a protozoan parasite called Trichomonas vaginalis. So this is transmitted usually by sexual contact. The trick parasite can be spread by toilet seats, wet towels, or other items that have discharged fluids on them. And in terms of symptoms, only about 30% of people that have trichomoniasis develop any symptoms. So vaginally, you may have discharge that is green, yellow, or gray, bad vaginal smell, itching in or around the vagina, pain during sex, or pain when urinating. If you have a penis, you may experience itching or irritation inside the penis, a discharge, or pain when urinating. So for treatment, there are antibiotics and anti-protozoal medication that is typically prescribed. And lastly, we like to go over pelvic inflammatory disease. Now, this is not a STI, a sexually transmitted infection, but is often associated with them. And that is because it is transmitted through an untreated STI. So if you have any of those above sexually transmitted infections that we just went over and it goes untreated, you may develop pelvic inflammatory disease. Symptoms do include lower abdominal pain, fever, unusual vaginal discharge, painful intercourse, painful urination, and irregular menstrual bleeding. And there are complications to this. That does include infertility, ectopic pregnancy, chronic pelvic pain, recurrent upper genital infections. But in terms of treatment, it is really just treating the STI that it originally started from. So a little bit of an overview. I know that's a lot of information to take in, a lot of different STIs to become aware and knowledgeable about. But some of the takeaways from this STI prevention is that no sexual contact is your surest way to protect against infection. Exposure does not automatically mean you will be infected. And some STIs can be transmitted via other contacts, such as mutual masturbation, oral genital, genital-genital, or anal genital contact. So internal and external condoms and dental dams all provide protection if you do decide to engage in sexual activity. But all in all, we like to just leave you guys with, if it burns, itches, or wasn't there before, go to health services, because we're not doctors. If you notice anything, maybe a change in how you're feeling or a change with you personally, physically, just go ahead and check with your doctor to give you a little bit of peace of mind moving forward. All right, so this last section is really all about communicating with your partner. So in this next slide, we talk about healthy relationships. Healthy relationships really include trust, being able to trust one another, respect, honesty, being upfront with each other, and having that open communication, especially when you're talking about sex. So within communication, we have expressed feelings, letting your partner know how you feel and your emotions about sexual activity, what you're comfortable with. Also within a relationship, there is encouraged independence, not being with each other 24/7. Also, your privacy is respected. You're not, snooping through their phones or, going through their belongings. Also, you want to be empowering each other, lifting each other up, but also creating a safe space. And that does include this sexual health information, creating a safe space to have that open communication, to talk about STI history, if either of you have ever had one, testing, whether you've been tested, when was the last time, when are you going next, expectations, what do you expect out of this relationship, what do you expect out of your relationship in terms of sexual activity. Maybe your preferences, maybe you are okay with some things, but you're not very comfortable doing other things. So have a conversation about that. But really just sex in general. Try to make that safe space and open communication so you both feel safe, protected, and comfortable. And lastly, consent. So in this next slide, I'll really dive into consent as a whole, because it is very important when talking about relationships and sexual health. Consent is permission. It is allowing the sexual activity to occur. It is clear, informed, and voluntary agreement between two participants to knowingly engage in sexual activity. It is active and ongoing throughout the sexual encounter, meaning all participants agree while it is continuing to go on. It is not silence or lack of resistance before or during sex, and it cannot be given if a person is unable to respond. Consent also must be obtained for every action. It can be withdrawn at any time. So if you're comfortable doing one thing and you guys move to another sexual activity, maybe if you're not comfortable with that, your consent can be withdrawn, even if it is kind of in the middle of the sexual activity. So it does not vary based on a participant's sex, sexual orientation, gender identity, or gender expression. And it cannot be given when a person's unable to do so under their own free will. So when they're intoxicated, blacked out from using any substance, they're sleeping, or if they have a physical or mental disability that permits the ability to give consent. So some people may have cognitive disabilities that manifest as someone is not able to speak on their own free will. So that's why we include that. In terms of talking about sex, communicating about it is all about getting the most from your sex life and doing so as safely as possible. So we'll dive into these tips on talking about sex, which includes exploring and expressing your preferences and sexuality, acknowledging levels of sexual desire, talking about being safer with sex, and getting tested. So let's dive in now to exploring and expressing your preferences and sexuality. So what is enjoyable for you versus your partner? Try to navigate that conversation early and often in your relationship. Many partners enjoy experimenting with different positions, So that knowledge of yourself and your body, along with your ability to communicate effectively, will play a large part in determining the enjoyment and the meaning of intercourse for you and your partner. Also, it is easier to relax and enjoy sex when you know that you are protected from disease and unintended pregnancy. So, what does health sexuality look like? Well, the first is consent. A person freely chooses to engage in the sexual activity and can stop the activity at any time. The second one is equality. Neither partner is dominant, both feel equal power in the relationship. The third is respect. You accept and respect your partner and yourself. Trust. You trust your partner with your body physically and emotionally, and you can each be vulnerable with each other. And lastly, we have safety. So you feel safe from STIs, unintended pregnancy, and violence, and feel comfortable with where, when, and what sexual activity takes place. So you are not making decisions under the power of drugs and alcohol. Next is acknowledgement of levels of sexual desire. So this really ebbs and flows. Sometimes it's throughout our lifespan, stress levels, hormones, or just part of who they are. Some people have no sexual desire, so you could be asexual. Some have a very low desire, and so forth. We want you to know that this is okay. The important part is being able to communicate this with your partner and to have an open and respectful conversation. In the next slide, we'll talk about safer sex. So that's initiating discussions with your partner about contraception and your sexual health histories. Taking an active role in discussing and really deciding what type of contraception is best for you and your partner. Buying and using condoms every time you have sex. Helping pay for contraceptive costs. If an unintended pregnancy occurs, just sharing in the responsibility and decision-making about the best way to handle it. And lastly, don't let embarrassment put your health at risk. Talking about safer sex may be uncomfortable, but it is worth the effort. So in this next slide, we have this chart, and this is really just to help you navigate those conversations around sex. So it can be kind of difficult. Maybe the person you're speaking with isn't on the same page as you. So on the left, we have some kind of excuses or things people might say. For example, don't you trust me? Your response could be, it's not an issue of trust. People can have sexually transmitted infections and not know it. So that could be a conversation on if people are talking about, using a condom or something like that. But there's lots of different sexual conversations to be had. For example, if someone says, I'm on the pill, you don't need a condom. Your response could be, I'd like to use one anyway. It will help to protect us from infections that we may not know we have. Another example, but I love you. Response could be, then you'll help us protect ourselves. So this is just kind of to give you some idea and help in navigating those sexual conversations with your partner. Sometimes, you may be put in a position where you might feel uncomfortable. So this is just to allow you to kind of speak your truth, what you're comfortable with, and what you want your sex life to look like in a safe way. So getting tested, you want to know in advance where you or your partner can go to be tested for an STI. That includes cost and what you need to do. If you've ever been sexually active without protection, you should be tested first. When talking with a partner, try something like, I'm going for testing and I'd like you to go too. That way we can both stay safe. Get vaccinated for HPV, hepatitis B, and hepatitis C. And if you contract an STI, ask your healthcare provider for advice on notifying past or potential partners. So on this slide, we do have resources. Of course, Student Wellness is who we are. We can provide you guys resources and information on this topic. But in terms of specific questions or questions relating to you or your own health, definitely utilize NIU Health Services. If you are concerned about something or something has changed, go ahead and have them check it out. Also, counseling and consultation services can be a great resource if you're trying to navigate those conversations with the partner, or you just need a confidential source to work through these things with. But also Open Door Health Center of Illinois. It is a great resource for people who are looking for a testing center or safer sex supplies and resources. So with that being said, we do have a survey if you wouldn't mind taking it. It essentially just lets us know how we're doing, how we can improve, and I will post that in the chat right now. There we go. It is posted. So again, just lets us know how we're doing, how we can improve. And with that being said, if anyone has any questions, feel free to email us at bewell@niu.edu. We'd be more than happy to answer your questions. And thank you for being here.